For more on President Trump's executive order on childhood vaccines, CBS News medical correspondent Dr. Céline Gounder joins me here on set. As you know, she's also editor-at-large for public health at KFF. Dr. Gounder, good morning and welcome. Clear this up for our viewers, because the EO recommends breaking up vaccines into separate medical visits. So what does the science say? Does it suggest that doing it together or grouping them is dangerous or causes autism at all?
So there is no evidence that spreading out shots is safer or that giving them together increases the risk of autism. And if there's one thing you take away from this conversation, it is to listen to your pediatrician, your doctor, not to politicians, any politician, when it comes to vaccinations or your health. Right now, this does not change anything because vaccination requirements, mandates are at the state and local level, school district level, and it's really unclear what impact this executive order will have anytime soon, if at all. Regarding a potential link between vaccines and autism, this has been studied thoroughly, more than just about any question in medicine, in more than 5 million children, in more than 40 studies around the world, and we see no increased risk of autism due to vaccines. But in addition to better awareness, better diagnosis of autism, something else tracks with increased risk of autism, which is genetics. We know that there's a lot of different genetic mutations that contribute to the risk of autism. This has not been studied thoroughly enough. And one other thing that tracks with this is parental age. So we know parents, both men and women, are having children later. When they do so, they're more likely to pass on genetic mutations to their baby. And we've paid a lot more attention to the fertility of women as they age, but we haven't paid as much attention to how fathers may also be contributing to this. So for every year a parent ages, fathers pass on about 4 times as many new mutations to the offspring as mothers.
Interesting. I did not realize that. But now, President Trump, who is not a doctor and has no medical experience, he suggested combining the measles, mumps, and rubella, that's the MMR vaccine. He says it could be quite lethal. Is splitting that up even possible? Fact check that.
So first of all, he's pulling that out of thin air. And then separating the measles, mumps, and rubella vaccines is not as straightforward as it seems. There is no manufacturer that produces them separately for the United States, so you'd have to go through FDA approval, licensing, clinical trials. This would take years to go through this process. And there's really no evidence that splitting them up has any benefit. In fact, there's a practical reason we combine them. They're a similar type of vaccine, a live weakened virus vaccine. They're made the same way, and they're due at the same ages. So you're actually saving kids injections by combining them at the same time.
So let's end the conversation where we started. For parents confused by this, you advise them, speak to your doctor, speak to your pediatrician.
Talk to your pediatrician. This has no actual force in reality right now. If anything, it's a political signal. This is not medical advice that was being given yesterday.
All right. Dr. Gounder with the fact check we all need. Thank you so much.